Alrighty, today we'll be giving a subcutaneous injection of heparin. Now the first thing I would do is I would check doctor's orders, and he says he wants 5,000 units of heparin, and on hand we have 10,000 units per milliliter of heparin, so I'll be giving 0.5 milliliters of heparin. Alright, the next thing I would check patient allergies, make sure he's not allergic to anything that we'll give him. He's not allergic to heparin, and the antidote for heparin is protamine sulfate. Now, the next thing I will do is I will check, I will gather my supplies. So I'll gather my syringe, my alcohol pads, my needles, and my medication. And then I will have washed my hands and apply some gloves. To draw out the medication with. Now, the 6 rights of medication administration are right drug, right dose, right time, right route, right patient, and right documentation. And then the different sites that you can give a subcutaneous injection at are top of the gluteus, outer thigh, back of the arm, abdomen, and love handles. And then the gauges you can use are 23, 25, and 26. And then the lengths of what you can use are 5/8, 3/8, and 1/2. Now, at this point, I would have wanted to check my medication 3 times. Once when I draw it out of the Pyxis, once when I'm drawing it up in my syringe, and once right before I give it to the patient. Now, let's jump into doing things with the vial. Now, what I would do first, I would take my vial, I would take my alcohol pad, and then I would cleanse the top of it, dispose of my garbage, and I'm not going to touch the top of the vial again because it is sterile. And then I would take my syringe here, and since I'm drawing up 0.5 milliliters, I'll draw 0.5 milliliters of air to inject into the vial, uncap my needle, and then insert it into the vial, inject the air, and then I'm going to turn it around and draw up 5 milliliters or 0.5 milliliters of heparin. Now the other thing, this will be the second time that I am checking my medication to make sure it is right. And along with this time, I will undo my needle here and scoop it up. And at this time, I would also check with other nurses, ask them, hey, is this the right amount? Which, to me, that looks like the right amount. What do you think? Alrighty, that's good. And so at this point, I would take my needle off. I would take my draw needle off, throw it in the sharps container, and get rid of it. Then I will grab a fresh needle, open up the packaging, making sure not to touch the hilt of it, and I will put this on my syringe. And now at this point I'm ready to safely gather my supplies and take them to the patient's room. And at this point I would have taken my gloves off, and then I will walk into the patient's room, wash my hands, put on gloves, introduce myself and others that would help me, identify the patient with 2 identifiers, ask him verbally what allergies he has, and then I would also check, do indications, ask him his name and birthday, and ask him to state them out loud. And then I would also do a focused assessment where I check lab values, because if his platelet count's really high, then it's good to give heparin because it is an anticoagulant, and his platelet count is very high, so I'm going to give him this heparin. Now, the next part I'm going to do is I've already gotten ready, so I will begin to give my medication injection. Now, what I'm going to do is I'm going to ask him what is a site that you want to be injected at. He chose abdomen, so I'm going to take his abdomen here, cleanse it with an alcohol wipe, get rid of my soiled alcohol wipe, uncap my needle, pinch up the skin, insert my needle at either a 90 or a 45 degree angle. So I'm going to insert my needle at a 90 degree angle, inject the medication, withdraw my needle, put a band-aid over it, recap my needle using the scoop method, dispose of my needle in the sharps container, and then I would document, because if you didn't document, it didn't happen.